Hello and good afternoon to everyone. So we're going to be talking about the AI in healthcare. And I'm sorry about this, I already look like a bit of a cyborg, but this is the easiest way to talk and walk and talk at the same time. So it's an interesting topic, and it has been over-publicized and not underestimated at all. So what to discuss today is, well, what is AI really? It's two small letters, but they have a lot of big impact on our everyday life, no less so than in healthcare itself. So it really describes the ability for computers to learn complex tasks, learn and perform, how to perform complex tasks, which previously were mostly done by humans and performed with the support of the artificial intelligence. Now, it is really how to make the machine learning and use the data to have practical applications in our everyday life, and to do have the machines do what the humans can actually do naturally to them. So we have all heard of ChatGPT. It's another iteration of the advancement of AI. It is actually getting us closer to this human-like behavior and adding context to response. Other applications of AI include, obviously, everything that is listed here, but most common known applications of AI would be the machine learning and NLP, natural language processing. Of course, we've learned about computer vision, analyzing images and faces, robotics, of course, the artificial general intelligence, and more recently, the generative AI. Now, a lot of people are asking, is it safe? Is it going to take over the world at some point? Are we at risk of human annihilation? Well, these are not, high probable, but they're not zero probable. Okay, so we need to be responsible when it comes to how we bring AI into our industries and our lives and our everyday tasks. So, yes, we have the right to be concerned when it comes to AI that can be weaponized, such as, instead of discovering new drugs, using it for chemical weapons. That's an extreme example, but it's not a far-fetched example. Misinformation is all around us. We've heard about, we've seen the deepfake, all of the applications of AI that have been used in the wrong way. Again, having AI concentrated in a force for evil rather than for a force for good is never a good thing. We basically can become dependent on AI too much that we are, giving our brains a break, which is, again, not a good thing. So we've seen the scenario portrayed in the Disney film. I think most of you will have seen it. I have seen it. The Wall-E example. And I think, AI is not that cute, but it can be dangerous. But AI can be used and has been used in a good way for good causes. Example of this would be the AI helping this patient walk again through basically planting a chip and sending messages between the brain and the muscle. And that is an amazing achievement for an AI application. Another one is basically just a few days back, AI was able to discover a total new antibiotic for strains of viruses. And that would not have been achieved if we did not have the data that could train the models that could come up with these outcomes. So, ChatGPT. Because it's the latest iteration of the evolution of AI, it's taking a lot of interest. There's a lot of uptake. It's so easy to use. It is democratizing the access to AI, which is a great thing, but also can have diverse effects at the same time. So we have an example here where ChatGPT scored higher on a medical quiz than a real human doctor. Let's have a look. So the question that was asked to the ChatGPT was, what is the risk of dying following swallowing and ingesting a toothpick? It's not your common medical condition, but hey, it's a condition. Someone swallowing and going to A&E may have that concern. So one answer was, as you can see here, it basically gives a very precise, informative response. And another answer was a little bit more expanded and kind of gave a bit more context. So, very quick raise of hands who thinks that the comment on the right-hand side was done by a GPT. Anyone would like to guess? And what about the left? One person. So one person is wrong, and the rest is correct, because actually ChatGPT gave the answer on my left. And when you look at it, you can't help but see that the ChatGPT response is more human-like than the response of the physician. It actually gave you a little bit more context. It's trying to comfort you. It's trying to tell you that, look, hey, things are okay. You're not going to die soon. The physician is saying, well, yes, along the same lines, but also they're telling you, in case you develop further pains, make sure you go to the emergency room and make sure you tell them that you have swallowed a toothpick. You know, that's obvious. So there's an example, but this is coming actually from a study where a panel of physicians were acting as judges, and they were asking human doctors as well as the ChatGPT on a variety of different medical questions. And the evaluations of 585 different cases came back with these results. So you can see the difference between the physician responses and the chatbot responses. On the whole, the accuracy and the quality was higher with ChatGPT, as well as more empathetic, which means the machine had more empathy than a real doctor. That's amazing. I mean, if you didn't know who's answering the question, and let's assume that the machine had a natural voice, then you would trust the machine to give you the right diagnosis or the right answer. Now, 79% of the cases, the chatbot actually score higher and were more empathetic. However, we should not trust it 100% because the rest of the time it was hallucinating and coming up with facts just because they exist on the internet. So here there is this dilemma. Yes, it gives you a great response and a great factual response 79% of the time, but we're talking about healthcare. We're talking about life and death situations in some cases, and we can't trust it yet, at least until it's 100%, because you can't have less than 100% when it comes to your health. So just an example of how at least it's developing. It definitely can act as an aid. It definitely has users. It is definitely making its way to becoming a significant part of our day-to-day lives, also in healthcare. So other successful cases in healthcare automation, in terms of what we do as Santecture, is using AI and intelligent automation to basically handle the mundane day-to-day tasks, increasing quality and reducing cost of manpower, focusing more on the healthcare delivery, And here are examples of some of the implementations of AI in healthcare automation. So you could have virtual nurse assistants in terms of the pre-consultation. You can have clinical diagnosis and decision-making support, as we've seen in the chatbot responses. Obviously, we've heard and know about the robotics implementations with AI, automation of administrative tasks, and of course, the image analysis in radiology and other practices. So other challenges do exist, and this is the area where we definitely specialize more into, is basically in the revenue cycle management and the medical billing space, where yes, you do need to translate medical records into accurate diagnosis and procedures that reflects the underlying medical quotes and records, but also we do have high, very prevalent level of errors in terms of billing, human errors, lack of information, the qualified and trained staff. The use of technology is on the up, but in most cases the use of technology is not where it needs to be or how it used to be used, inefficiency and failure of handling this process basically affects your revenue, integrity and revenue potential. So these challenges are real, and those of us who actually practice within the RCN space, we know that these challenges are a daily occurrence. They happen every day. We have high cost of operations, we have high denial impact, we do have impaired revenue integrity, revenue leakage, delayed data insights, which basically is a result of all of that. If you don't have the data and you're not managing your claim cycle in the right way, then everything else will fall apart. In 2 countries, as an example of prevalent RCM issues, we have 15 to 20% of revenue being affected purely by denials that can be helped, that can be prevented. That's 20% of revenue, which is a huge amount. 40% of denials are around administrative-related issues and errors, which is avoidable totally. And basically, the rest of it is based on lack of medical necessity, or the wrong diagnosis, or the inaccurate coding of the medical record, and as well, of course, the lack of documentation when it comes to the underlying medical records. So, although each country has its own challenges, UAE, for example, as an example here, they do have a longer track record in terms of automating claims and managing the medical coding, etc. But still, they have relatively high denial percentages, and there is still much more technology adoption to address these issues that is still ongoing. And mostly the reason is because the emerging technologies only started to appear in the last maybe 2 years, and more so in the last 12 to 6 months when it comes to the more advanced implementations of AI, specifically in the medical space and the administrative side of things, because data has become more and more available. We are now able to train our models and the predictive analytics engines better, because the quality of data coming into them is getting better. Saudi Arabia is going through a transformation, and that transformation is a challenge if technology is not adopted in the right way. So again, the introduction of medical coding and the availability of the manpower, or the lack of availability of the specialized, experienced manpower in this space is adding pressures on the existing, already struggling RCM functions. So we see solutions concentrated in the automation, intelligent automation to be more specific, and the use of AI in this space is only going to grow. And data, the more quality data that's being fed, the better the outcomes are going to be. So this is in general what we think where we're sitting and how we are working with closely with our clients, that RCN Tech is a new term. Basically talking about RCN Tech, but generally speaking, we have the fintech, we have the health tech, we have a lot of tech. We have the insure tech. RCN Tech is not just another acronym. I think RCN Tech is going to be extremely important for the sustainability of the healthcare sector, because it tackles the revenue, and when the revenue is related to how, to the quality of your billing practice, then it has to be a core function. And that's where we are emphasizing that you must deploy RCN. You will deploy RCN Tech in different ways, shapes, and forms. There is not one solution, definitely not only our solutions that you will need to consider. Each environment is different, and our advice is always work with a partner, don't work with a solution provider. Working with a partner means that you customize and you get the best out of these emerging technologies, because there are no out-of-the-box AI engines that will address your localized issues. It's a journey that requires transformation and support from both sides. Equation. That is it for my talk today. I hope that's been interesting enough for you to lighten up the afternoon. And I think it's been a great conference so far, and I thank you all for your attendance and participation.